Hello, this is Dr. Erica Scott, and I am the planning chair for the Creative Arts and the Expressive Arts Therapy educational track for the West Coast Symposium. And today I'm very proud to have the 2020 faculty with me to discuss about art therapy, the definitions, the meaning, practice, scope of practice. I will, in a minute, I'll have each one introduce themselves, but I will tell you a little bit about myself. I have 36 years of experience. I've been working in the field as a professional, as a core faculty member, as a therapist, as a supervisor for a long time. I'm licensed in California, Arizona, and New Mexico. And I'm also board certified as an art therapist and a registered expressive arts therapist. And so I've been published by UCLA, Oxford Press, and Hayworth Press, and the Journal of Chemical Dependency. So I do need to tell you that I have no conflicts of interest to disclose. And I would then like to pass the baton and have each of my faculty members introduce themselves. These are outstanding clinicians. These are outstanding presenters. And I've seen all of them present, and some of them have presented more than once for the West Coast Symposium, and they're the cream of the crop. So thank you for joining me, you guys. So who would like to go and introduce themselves first? Do I have a volunteer? I can pick somebody. How about Elizabeth?
I was going to say, you have to choose.
I did.
I have nothing to disclose first, so get that out of the way. My name is Elizabeth Davis. I am the director and a faculty member of the Trauma Institute and Child Trauma Institute in a satellite in Buffalo, New York, but our main location is in Northampton, Massachusetts. And I specialize as an EMDR therapist and an intensive trauma therapist. Work with all kinds of clients who have experienced trauma. Also trainer for basic training for EMDR and attachment and dissociation. And I'm a creative arts therapist in New York. I'm an LCAT and board registered or board certified art therapist as well. Have about 22 years of experience in the field of art therapy, and just so pleased to be here with this great panel to talk about art therapy and addictions, and put our heads together and explain a little bit about how we work with substance use disorders. So thank you for having me, Erica, and inviting me, because it's been a pleasure so far.
Wonderful. I hope to see you year after year. All three of you. So how about Rebecca?
Sure. So my name is Rebecca Sludge Johnson. I am a registered art therapist and a licensed professional mental health counselor in the state of Tennessee. I work in residential drug and alcohol treatment. And also do some work with a place here that does some intensive workshops that tend to be week-long or a few days long. And I've also done a lot of work with sober living in town. My resume is not quite as impressive or as long. I've been in the field for about 12, 13 years. And also have nothing to disclose, before I forget to say that. I have no conflict of interest or financial gain that comes from this. But I'm very just grateful to be a part of such an impressive group. And thank you for inviting me. I'm excited to be here.
Me too. And Peggy.
Hi, I'm Peggy Kolodny. I am a licensed art psychotherapist from Maryland. Been in the field for close to 40 years, started very, very young. And I'm the founder of the Art Therapy Collective, a private practice in Baltimore County, where I see populations across the lifespan, toddlers to geriatric, basically trauma informed. So certainly substance use is part of that population as a coping mechanism, I should say. I'm also teach a lot. I'm on the faculty, adjunct faculty for University of Maryland School of Social Work, teaching art therapy, and on several professional training faculties. The Ferens Institute for a trauma certificate, and Chesapeake Beach professional seminars for play therapy certificate. So love to teach, love being here, and I love being able to educate people. I think we're all very passionate about our field, the expressive arts and art therapy, and so we love sharing that information. And I also like to have an integrative approach. So I have a level 2 certificate in EMDR and in internal family systems, and integrate those into my work. I think we all integrate models into art therapy here.
Absolutely.
Yeah.
Very good. And I think you said that you don't have anything to disclose.
No, I have
but
no financial disclosure, nothing to disclose. So no conflict.
Okay, great. All right. So I, with the faculty's help, have prepared a few open-ended questions for us to discuss as a group. And even though we get along famously, we have probably some different opinions about some of these issues, which is great. It makes for a healthy, vibrant, dynamic dialogue. And so I will encourage people to tell the truth about how they see things. And if there's some differences, fine. And there'll be, of course, more commonality than differences. But so the first question is probably the basic. I'm asking this one first to set the stage for the questions that follow. And I, instead of just saying, what is art therapy, I decided to ask, what are the differences and the similarities between what is defined as the creative arts therapies and the expressive arts therapies? Some people just see it as a continuum. Some people see the practice very different. I'll give away a little bit when I say one's considered more multimodal than the other. I never thought creative arts therapy wasn't multimodal, but so there you go. So I thought that might be a way where we could talk about some of the definitions, but also talk about there are different ways to practice. So, and then after that, let's talk about drug and alcohol, but I'll ask a more specific question when we get there. Okay, so who would like to take that on?
Okay, I can begin.
Absolutely.
Well, art therapy, if we just use those two words, because in several states, they're title protected. So
Yes.
that expression, those two words together, and that's to help not confuse the public. And I think that's why this is a great opening question to educate these definitions. But art therapy as a profession is a master's degree program, and it would be the training's equivalent to a master's degree in any other mental health field, such as counseling, social work, psychology. And in at least about 14 or 15 states, I've done my homework,
Whoa.
can be licensed as art therapists or licensed as professional counselors, if not both. So you have that professional level, but as a definition, the way I really see it in practice is seeing art therapy as a psychotherapy. And it's been a continuum since the beginning. It began really formally as a profession back in around the 1940s. Sort of this collective unconscious spontaneous explosion all over the world, where in different countries art therapy started emerging as a more formal profession, not just in the States. And it was seen as either art as therapy or art as a tool in therapy. So art as therapy is more as a psychotherapy approach, but art as tools, and I think that's the overlap with expressive therapies, where you're using different creative arts in therapy, along with talk therapy. You may be doing it outside of therapy, bringing it in. It's
There you go.
Right. Yeah.
I'm just thinking about some people listening may not even know really what art therapy is. So what you said about bringing the arts into therapy, I think is very important. Okay. Very important for our audience. Yeah. Okay. Did I interrupt? I didn't mean to.
No.
Okay.
I can always say more, but would love to hear some other input.
Okay.
Well, I mean, I think, Peggy, you just said it, pretty well. The outline of our profession seems to be the lines of education and politics to a degree, but the practice is different because the way I was taught as an art therapist was very multimodal. We learned play, we did some drama, we did centre, we worked in all kinds of different mediums. And in expressive arts therapy trainings, there tends to be a methodical working through of different media to integrate different media into psychotherapy. Art therapy sometimes has gotten pegged as just being the visual arts. And that's not the way I was taught in the program I was in 25 years ago, but things have evolved and fault lines have come into play. As a practice, as a practitioner who's treating somebody with trauma, I'm not thinking all that stuff. I'm just using expressive modalities, music, art, movement, whatever, in a fluid way that's kind of suits the individual client. So it's confusing, I think, for the consumer out there because these labels and the actual practice sometimes seems a little ambiguous and fuzzy.
Well, you bring up a good point, and I started talking about it as a master's profession because actually there's a master's degree in drama therapy, a master's in music therapy, a master's in dance movement. So there are those boundaries to get very specialized, intensive work in that education in those fields, a lot more deeper theory. And I think we all integrate the different creative arts into our work, but to have that respect for knowing our limits of what we do know. So I think all of us do a lot of continuing education and learn a specific approach or directive that is appropriate for our population or a client. And that's the ethical piece.
I think to use a medium, you need to have some experience in it.
Absolutely.
And you need to experience yourself, usually to a degree. And I think different medias might actually need a lot more hands-on experience than others. That's my experience anyway, that for instance, if you're using paint with a client, I feel like that needs a lot more experience than if you're offering a set of markers and some paper. But at the same time, there's so many complex things about the way art therapists and expressive therapists, just their intentionality has a little bit of a difference to it that is more about what we do than it is about the nuts and bolts techniques, which everybody gravitates towards.
I agree with that.
I agree. I agree. And I think, and I've heard other music therapists, that's coming to mind, who defined it this way. If we as art therapists or as an expressive art therapist play music in a session for a client as they do artwork, or we may play music for play therapy or centre, that is bringing music as a tool into therapy, but that's not music therapy. So I think that's that language difference that really clearly defines it, that we can bring in expressive arts in different modalities, but that doesn't make us those two magical words, music therapy, drama therapy.
Right.
And the other thing that ethically I always pay attention to, if I learn a new directive, okay, a new art or music or any type of directive, my first thought is, oh, this is really cool, I want to try this. That's not ethical. I'm not thinking client first. I'm thinking, I want to try this. So what's ethical is, what client would this be really appropriate for? What treatment goal would this intervention meet? And how can I modify it to meet the client's needs? So I think all of us really, it's client first. How will it be?
So important. Boy, Peggy, I think what you just said sums up so much about treatment in general. is that it's not about how cool it would be to learn this or that. When I'm with a client, I'm working the phase model of trauma. So I'm working in a model that says, what's next for this person? Not what would I like to experiment with this person?
Right.
You know? And how do I get them to their goal in the most efficient and profound way possible for them?
Which is also interesting because we can plan ahead that this is what we're going to do. But there's so much with spontaneity in our work.
So
And that's where
important.
the creative thinking comes in. You may plan to do watercolor, and all of a sudden you're doing clay because the client is going to find that three-dimensional work more expressive for what they're processing.
Absolutely. So I have an example. I'm disguising this because it's public, but I had a client that was failing treatment, and I read that person's chart, and the chart actually recommended that they not do expressive therapy. But I felt they really needed an expressive arts intervention to engage them in treatment. They were not engaged. So I went to our psychologist and her psychiatrist, and I said, I see that the chart doesn't recommend this, but this person's not participating. They're going to leave treatment without having done their assignments. And when I watch this person, they move like a dancer. Now, I don't have background in dance therapy, but I've been a therapist by 20 odd years at that point, and we had the psychodrama that we offered 3 hours every week, and I had a co-therapist. So I presented that to the psychiatrist, the psychologist, and my co-therapist, and we decided to try it. So I asked this person, I actually just spelled out what I saw and my concerns and the way they moved, and that person said, I can't dance. I cannot dance either. And I said, I will dance with you. And it was a trauma that I was asking this person to dance. And I was a little worried that it could be chaotic or frivolous or too activating. But I want to tell you, it's probably the most beautiful dance I've seen in my life. So that person stood up. I could tell they were in it. And I sat down. I didn't even need to participate. And we just watched as this person played. It's so interesting. This person spontaneously played every single person in the traumatic event without being asked. And then when that person sat down, I said, the only thing I would like to ask is that you dance back into your scene and rescue your inner child. And I'm still getting goosebumps. But what happened is the person became engaged in treatment. All of a sudden, they had the energy to do their assignments. All of a sudden, they were able to present and talk about their life story. And what also happened is that person had a kind of a mean streak in the community. So everybody had pulled away because being close to this person hurt. But after people saw this person, I don't want to say the gender, dance their trauma, everybody moved closer. And it gave the community support that was necessary for the person to succeed. And so while I totally agree we need training, I've never done dance therapy again. It just was in this case, that person moved like a dancer in space. Every step they took was graceful. And you've seen how dancers walk, right? They have a certain presence. So, so I just say that to illustrate for people that have a hard time conceptualizing without a story, exactly what both of you were saying. It wasn't about me wanting to learn about dance therapy. It was me observing the client and ascertaining to the best of my ability what the client needed. And even though I was not totally comfortable with it, and because I felt that was the best intervention I could come up with to turn this client around. So, and I'm sure each of you has a similar story, but we probably should move on a little bit Is there anything, Rebecca, did you want to add to the art therapy, expressive arts therapy conversation?
You all did such a beautiful job of covering so much. I don't think I have anything to contribute right now.
So the next question is actually Rebecca's question. She asked or suggested that we discuss how can, and I'm frame it as a drug and alcohol counselor, because that's mostly who we're speaking to, and not just a lay person, but a drug and alcohol counselor in addiction treatment, utilize the creative process and apply techniques in a way that does not cross the scope of practice and expertise set by the licensing boards, because practicing outside of the parameters of your license is pretty serious. And it's serious for the client, and it's serious for you as a professional. So this is a hard question to answer sometimes when you have someone that's very passionate. They see the power of bringing art and drama, psychodrama into the arena, and yet, so what do we do? And there are a lot of people practicing what I think is now called therapeutic arts that's not considered the same as art therapy. I find that discrimination a little loose, but the reality is this going to happen. So how do we do it safely? How do we support, but also have conversations with our colleagues? I think this is a question that's probably most important to people watching today, is how can a drug and alcohol counselor engage in the creative process and apply techniques and not move out of scope of practice?
And I think one of the most important things that I face, or one of the most important roles that I've found that I can take on or that I can control within my treatment setting, is to do a lot of advocacy and education. So whether it's just we try to do at least once a year, like a grand rounds where we can kind of explain what we do, how art therapy is, who would be most effective or whatever,
benefit.
Who would benefit best from art therapy. And I get to work with all patients in group settings. And so then kind of being able to help the counselors understand how to identify who may need some extra individual attention. And so part of, the education piece definitely helps a lot. But then you're right. I think that you phrased it really well, that there are a lot of counselors that have a passion for it and are deeply excited about it, and begin to call what they do art therapy. And so kind of, I don't know, it feels like there's constant education that I think has to happen and has to go on. And we have to be very vigilant and very clear in setting boundaries, but also supporting that there is, an appropriate place in the clinician's handbook for some creative interventions. What about you guys? What have you found with other clinicians?
I would have to say I teach a lot of clinicians different approaches to arts therapy. And I started off with a lot of education and a lot of advocacy about the field. Because I think that what has happened in our field to some degree is a bit of segregation from the rest of the therapy field.
Yes.
I don't want to feel like we're not a part, because then people don't understand what we do and they don't appreciate it to the depth that they could. So what you were saying, I think, was important. There's a lot of education, a lot of showing other clinicians how we work and what good work we do. It's not protecting all our art materials and pretending nobody else can use them, but it is also showing them an appreciation for the complexities of doing this kind of work. I think it's wrong for people to call themselves art therapists when they don't have a master's degree in art therapy. I think that just is wrong. And they need to be fully disclosing to their clients that, okay, I learned this in a workshop, and I have art therapists that I work with or talk with or counsel me on this, and tell me your feedback on how this goes. I think it's important that we present information out there for other counselors, but we have to do it in a context that really appreciates our field, but at the same time doesn't look like we're hiding anything, because that doesn't help us either.
No.
Right. I would say half of my professional work is as a clinician, and the other half is actually teaching about the use of art and therapy to non-art therapists. I think it started out because I do work with kids as well, and I have a funny saying, you don't need a license to carry a crayon. You can't go in and say you're not an art therapist, so have that 5-year-old put down the art materials. You know, we don't own the art. And we know art is therapeutic, and it has been since Cro-Magnon was painting on the cave walls to express their rituals and their stories. So we know,
That's right.
right? And it's compassionate and ethical then to share our knowledge with other professionals, take away that mystery, but also establish the boundaries. So I see that as that art as a tool in therapy more approach. And I think the biggest question I get from students, whether they're graduate or professionals, but non-art therapists learning about art, is they'll say, well, a client drew a picture, now what do I do? What do I say? How do I process it? They start hitting their brick walls.
Yeah.
And there's that myth that we analyze art, that somehow they'll draw and give it to us and we read tea leaves. So we're going to look at them, everything, right? So, which was a foundational piece of my education 40 years ago. There certainly was that psychoanalytic piece, and it has some value, but it's really more in the relationship we built with the client and how we ask the right questions for them to interpret their art and tell us what the art means to them. And I think that brings up process and product, the process of creating and what they create, whether it's music or a poem or a piece of art or a sculpture or a dance. So people that aren't trained in it and want to bring it in, they're going to hit their brick walls. And I think it was you, Elizabeth, that brought up the point. Then you consult, you get supervision, or you call an art therapist and say, can we discuss this? And that would benefit everyone.
Everybody, thank you. So what if a drug and alcohol counselor asked a client to paint a painting of the trauma in their family?
So as a trauma therapist and as an art therapist, my flags go off, right?
I had a somatic response to that.
I saw that.
Right?
I saw that. Okay, so say why. Why would that be a problem?
Well, there's a lot of context that we need.
Of course.
They need to know that client, right? Is that something that is meeting the therapist need, that they're trying to gather material and they want to know how it impacts the client? And if so, is the client ready? Is it the client's choice to bring their trauma in, whether even if it's nonverbal through art, it's still a narrative. Are they ready for that narrative?
Yeah. I mean, it's potentially destabilizing, particularly with somebody who struggles with any kind of substance use. Yeah. Because you're activating the trauma that could send them into a flashback emotionally. Could, you're stirring up the stuff that's too much inside. And paint, of course, we know can be very disorganizing for a lot of people who have experienced trauma. They could perseverate and definitely dissociate.
And relapse.
Right.
Yeah.
That was the first thing for me, was just even, the idea of someone who doesn't have the technical, just in facilitating the method of painting and trying to create some containment within that, with something that's already very triggering. And that immediately brought a lot of discomfort and thinking about someone, just the importance of being able to contain the experience for the client.
But you can imagine it's a mistake that a young drug and alcohol counselor might make, and with good intention. That I want to make that clear, with good intention.
Sure.
So it's not, what I heard is, it's not don't do it. it's get consults, know your client, where they are in treatment, how stable are they. It would be important if they're in residential treatment at the time versus outpatient. That would be really important. It would be, are they managing their triggers already? Are they able to manage them safely? How motivated they are, I think is a really important key. Someone who's super motivated will come to you and say, oh my gosh, I'm having a really intense reaction to that and I need help. Someone who's not so motivated might be a little more laconic about asking for more help if they need it. So, and I'm going to say something that's going to sound contradictory. I know it's really important, and I hear it discussed about not triggering the trauma vortex. And yet I have seen times in residential treatment, I want to qualify in residential treatment, where someone was triggered by, say, their psychodrama and it ended up being hugely therapeutic. And you need to have the skills to bring a client back out of a trigger, out of a NAB reaction. And you need to have the skills to help them reframe it and integrate it in a way that's therapeutic versus re-traumatizing. So that takes a little time. And that's probably not for someone who's just a drug and alcohol counselor.
Well, every trauma model starts with building safety and stability and
Yes.
grounding and containment.
Mm-hmm.
So that's really what you're talking about. But I'm also going to go to the other side, as you did, because I have a strong belief that victims of abuse were silenced. They didn't have a voice. In lots of ways, they weren't able to get help and tell. Right. And that could be child or adult, right?
Absolutely.
In therapy, if they spontaneously feel the need to tell their narrative, and you as their therapist feel, I've known you for 30 minutes and you're already giving me, kind of throwing up, as we say, the whole story. It's not silencing them, but bringing in our skills to help them pace that story, letting them have that voice and not saying, no, it's too early. We haven't built grounding and containment.
Which would mean nothing to a new client.
Exactly, right? Exactly. So that's where the skills come in. And again, that's where the arts therapies can be great too, for them to contain, because there's a natural containment quality to non-verbally put it on paper, to express with a boundary around it rather than in words. And that alone can begin some of the containment.
So for those who are listening who might be interested in becoming an art therapist, what are some of the requirements? I know you touched on it, Peggy, earlier, but what does it take to become an art therapist?
A master's in an art therapy counseling program, first off.
Well, there's prerequisites to get into it. I think most of the degrees, most of the programs hold, and that is you have to have a portfolio of art based on four mediums. So it'd be paint, drawing, and clay. I think it's just the three. It's paint, drawing, and clay. So they want you to have an understanding of working with art materials and the creative process. It's not about talent, but it is about skill and being familiar with the technical part of the materials. And while not talent and awareness of the creative process, there are, and I've seen this in students where there may be too concrete thinkers. They haven't gotten that level. That doesn't mean they won't, but the more exposed they are by taking some of these foundational courses, a drawing class, a painting and clay, I think we'll tap into, I think everyone has creativity and they'll tap into that.
I agree. So a master's degree, in my case, I already had a master's degree, so I did a postmaster's college graduate level certificate, another 21 hours. And then I think my practicum was 700 hours. I don't know if that's current. And then I embedded art therapy supervision into my well, actually by then it was my postdoctorate internship. So I had an art therapy supervisor on top of my other supervisors. So I didn't have to do it twice.
In New
So-
York, I came to the art therapy field kind of in a windy way. I got my master's in fine art before I came to art therapy, and was working as an artist and a graphic designer. Went back for another master's because you know how much money and support the art field gives artists.
And art therapist.
And art therapist. Okay, so this was a step up though, right? So at the time when I started my art therapy master's program at Nazareth College in New York, it wasn't a licensed profession. And then by a few years, I'd say about 5 years into the field, working in a residential facility for youth, we got licensure for LCAT in New York. And now it's a regular master's program like any social worker counseling program is. We're still fighting with insurance companies and that sort of thing here and there. And it's been going in the right direction. A lot of it due to people not really understanding what art therapists do. And a lot of the politics in New York State in particular, there's a lot of politics around our profession. I've never had a hard time getting a job as an art therapist. Once people realized how beneficial it was, I only got more hours and more exposure to opportunities to work with clients. It's not something that you have a kind of belief out there. I think if you become an art therapist, you're going to have a hard time getting a job. It isn't what I've experienced actually, though.
I have not experienced that either in 40 years. And I think the issue are people that are looking specifically for an art therapy position rather than looking for a mental health position and saying, here's what I can bring to it.
Mm-hmm.
Yeah, I started off as an art therapist in a residential facility, but then I worked as a mental health clinician. And now, you know, I mean, lots of different jobs in which the license can work in. And in a way too, cross-pollinate with other therapists that then understand art therapists more and come to appreciate having them in clinics and programs.
And in the team meetings, I think art therapists bring a lot to the team meetings.
Something soothing, I think, too. I mean, I think about art therapists as having a soothing engagement with really hard stuff. And it really helps the morale. You know, everybody's kind of curious and wanting to know about the use of art materials just because it just brings another dimension of soothing expression to even colleagues. It's been my experience anyway.
I totally agree with that. I actually say I don't know that I would still be practicing if it wasn't for the soothing quality of the arts as an observer. I really support that.
And I think that other professionals, it's a foundational piece of art therapy. And again, all the creative arts, that nonverbal piece. But when we talk about, there's so much we can't put into words. And when they see how much can be expressed nonverbally to really deepen an understanding of the client, a story comes to mind very briefly, but I had a very, very brilliant doctoral student as a client with a pretty severe anorexia and depression. And her psychiatrist wasn't quite getting it. He had her on medication, but it wasn't enough. She did a piece of artwork for me in our very first session that was so profound and took it and showed him. And he looked at it and said, "Oh, I didn't realize you felt like this." And not even realizing what he was saying, but looking at the image, he got the depth of her despair and pain. She basically had scribbled red and purple and and black on a piece of paper, just scribbling. And that's part of that somatic sensory experience, right? Getting it out. Took a second sheet, put it on top and taped the edges. And then and the top piece covered in soothing blues and purples. And then took her hand and ripped it. First she cut it, and she was a cutter herself, right? Self-harm. She cut a little bit and then ripped it open. And she said, the blue is how I appear to the world. The red and black is how I feel underneath.
Yeah, beautiful.
So that's that process too. That product showed it, but that process of ripping it open also really helped everyone understand her need for self-injurious behavior as well.
Peggy, that example, I think of so many clinical minded people seeing someone in terms of their symptoms and diagnoses and the spectrum of what it is that is on the checkbox list.
Right.
Seeing an image gets to their heart, that hits them in an emotional way. So now they see a human being with much more fullness.
Well, I think that brings in the mind-body piece too, doesn't it? Because when we do the diagnosis in the DSM, it is these words. And the client says, I feel sad. But, we bring in that body when we do the art or do the movement, it touches your soul, your heart. It taps into all those sensory, somatic responses that we have. It uses the whole brain. Yeah.
I also consider art therapy an energy medicine because each color has a different energy. I see what appears to me to be an energetic healing when people paint or color. That, of course, it happens in talk therapy, but I think the color shapes, I think it empowers it, the process of energy healing.
Absolutely.
Absolutely.
Yeah. Yep. Okay. So how about, is someone able to describe what a group in a residential program for drug and alcohol or outpatient and everything in between, what an art therapy group for drug addicts and alcoholics might look like in a way that people who are listening can visualize it?
I get to work with both adolescents and adults in residential treatment. And especially with the adolescents, I found that it's really important to have separate check-in and closing activities. A check-in activity that gets them engaged physically can be really helpful. One of my favorite things to do with the adolescents is just to have them pick up a hunk of clay or a container of Play-Doh and create a sculpture in the beginning, just as a quick check-in piece. But even, the tactile, like of warming the clay up, they can throw it against the wall, they can throw it against the floor, and just kind of having them get up and move is really, really helpful with just kind of bringing them into the setting. And also just kind of, I'm not really setting the scene for it to be a very open, safe place, I think. And then having a directive, some of the groups that I do, I know that I'll only get to see the patients once or a few times and try to do something that can start and finish in one session. And then a checkout where we tend to process. It's optional to share, but certainly encourage it. And most of the time, everyone chooses to do it. And in the closing, the processing part, I really try to encourage getting feedback and interacting with each other's pieces, just to represent and kind of really dig into the coming out of isolation. Addiction has so much isolation that goes along with it. So really having people start to understand and see how much they can connect and build relationship with one another from what they've experienced. Some of the groups where I know that I'm going to be working with the patients longer term can be a bit more open and kind of revolving door groups where, you're going to have people coming and going. But I find just to have the format of having a check-in and a check-out to be really important, no matter what we do, no matter how heavy the session may be, just in providing some containment and predictability.
Wow. Okay. And what might be a directive that you would use in the middle of the session?
One example of, well, we talked about painting, painting powerlessness. So what powerlessness feels like. And a lot of the adolescents I work with may not identify as addicts, and that's fine. You know, I want to meet them where they are in that. So, and that I just ask them to identify a time that they felt powerless. And it may be coming to treatment. It may be having to go to group that morning. But just to then kind of connect what that powerlessness feels like, how they can externalize it, what color comes up for you when you think of it, how do you feel it in your body, and kind of just at least allow them to experience some of that process of being able to externalize and understand things a bit better by putting it out on paper in front of them. But I enjoy using paint specifically in an exercise like that, because it can be very, I don't know, somewhat regressive and definitely emotionally evocative. And so it can be a really good way to tap into and really dig into the powerlessness piece and kind of re-experience it. But then again, the importance of being able to safely close and contain it in a residential setting. But that allows a lot of flexibility, which has been really powerful.
That's great. And then they can notice it if they start to feel it again. Now they have an experience of it, and it could even inform them if they're headed towards relapse, for example. It's a great exercise.
That really, like in a check-in with them, like the only things with the adolescents, for example, the only things that I ask that they not do, or they're doing a self-portrait where they're actively intoxicated or painting paraphernalia, and really try to get them to dig more into what it feels like rather than what it looks like, and then ask them to use that as the image of powerlessness or of their disease, and kind of starting to remove some of that shame too.
They're very good, thank you. There is research, excuse me, I think it's Corlin, that drug addicts and alcoholics that paint paraphernalia in treatment have a higher rate of relapse. So that's interesting.
Makes sense. I mean, there's that trance with the substance that is still at play, that idealization of the experience.
Right. Especially in the group. And then there's this group support of that. That social connection, that this is what we all have in common, and they're trying to make that social connection, and often chose inappropriate ways to do that. I've done mural groups for trauma informed and for people in recovery, but if they're 12-week or 6-week, if they're a short-term close-ended group, and it's a great way to assess group dynamics at the beginning. As a warm-up. It gives a therapist a sense of the personality, who's the leader, who is compliant, who gives in, who stands off to the side. You really, such strong dynamics. And you watch the growth of those murals throughout. I've seen initially, I would say 99% of the time, they draw a picture together, there's boundaries. Even if it's a natural one, they'll draw a stream. They may just draw a straight line. This is my section of the paper. Or a tree that kind of, I'm on this side of the tree. And by the middle to the end, you don't even know who did what. There's just this beautiful integration, which is really speaking to the group working together. And it helps reflect family dynamics.
Very much.
You know, that reminds me of a project. I used to do this program called Sitka Arts. Sitka Arts. It's a evidence-based program for youth and juvenile justice, and used to work in residential treatment. And what you just said reminded me of a project where I had, they're all kind of kids, you know, who are in juvenile justice, or a lot of them gang involved. And they made a map of their city in 3 dimensions using all kinds of 3-dimensional collage material. I've never felt so much connection and insight into their point of view, seeing these youth create their city streets and the buildings, and kind of, you know, molding them and having to work together, and, you know, where's the drug house, or where's the safe place that we go to hang out and do whatever. You know, you see them organizing around what community is for them, and how much community matters so much to how they're thinking about their defenses and why they are the way they are. I mean, they've had rough, tough, challenging lives, and it comes out when you do group work, I think, like that. It's powerful because they learn so much from each other that they won't hear from you. You know?
Yes. And art allows them to step out of what was real into imagination, and the imagination helps them to develop a new way of being, a new way of coping, a new way of having community, healthier ways.
Right. Elizabeth, I want to introduce you, and I'm going to say it right here on the podcast, but I want to introduce you to Jo Chemansky, who is head of the art therapy program at the University of Haifa, because she did a similar process with children who were immigrants and had to move and leave their homes. And she's published about it. And I just think you would have a lot to share about that. And that would be a great cross-cultural article if you're so inclined. One thing that showed up is how much the children put in the drawings that they weren't sure were accurate. And then when the parents came in, they were stunned how much the children remembered. So yeah, it was moving.
That sounds fascinating. Wow. Cool.
Isn't that cool? Yeah.
You just tapped into another benefit of the arts therapies too, that when we draw, we have more memories than we can put into words. So there's been studies.
Moved to another place. Somehow I froze. Okay, there. Okay.
You're back.
Okay, good. Okay. So anybody have a question they want to ask? I can come up with more, but you guys are brilliant. So anybody have an open-ended question they think might be answered by an open-ended question that might answer questions the audience would have? Oh, I know. Unless did someone raise their hand before I did? Okay, so much for being a good leader. I would like to ask each of you, like, just a little bit about what personally inspires you about this work, because I feel inspired by it. And so I don't know if you can think of a story or a personal experience, maybe even your own art that has inspired you, or your art with clients. And I know we want to be very careful about HIPAA and confidentiality and privacy. So you can either leave out a lot of details or disguise a little bit, holding the integrity of the experience. But I don't know, what inspires you?
Peggy, I saw you making a warm smile there. So I thought you have a story that's brewing there.
A lot of stories actually, but it's, you know, it's funny because I've been in this field for so many years, and yet the story that comes to mind is probably my first or second case, and I was still an intern. But I think that's what lit my fire too.
Yeah.
So it was and this will be a little graphic, and I'll try to be protective.
Yes.
Of our audience with triggers, but it was a young girl, 3 or 4, who'd been sexually abused with medical evidence. So we'll leave it there.
Okay.
And because of the medical evidence, we knew it happened. There was no doubt. It was that strong. And she got interviewed, and we're talking 40 years ago. She got interviewed by the police, and I had this image that they had a light bulb over her head asking her, where were you on the night of July 2nd, right? So,
which is heartbreaking, by the way.
It is heartbreaking. So by the time she got to me, she had been interviewed by 9 different people: detectives, police, social workers, nurses, doctors, psychiatrists, 3 or 4 years old. And then someone said, send her to the art therapy intern, right? And she came in and we did some play in art, but I basically gave her, one of the things I did is I gave her a teddy bear and said, he's a puppet. Everyone tells him their secrets and he keeps the secrets. And she took it home, and her mother said she whispered to that bear for like a week. and then brought
Aw.
it back, and the bear had all the secrets. So now she's testing, right? Will the bear tell me? Will I know? I offered her art, and the first thing she did is I gave her a piece of paper. She reached in the trash can and pulled out a scrap of paper and drew on that. It was sort of this symbol that she wasn't deserving of new paper, but
Oh.
a piece of trash, how she felt. There's so much metaphor, rich metaphor.
Mhm.
And soon, it was within weeks, I had her finger paint. So we all know the sensory qualities of finger painting. And all she had to do was just get her hands in there and paint with her hands directly. And she did her
Gross.
disclosure picture. She, with her fingers
Hold
in
on.
that painted what happened. It
Can
was,
you repeat that, Peggy? We all froze for a minute.
I'm sorry, she used finger paint to explicitly draw what happened at age 3. Explicit, because you're looking at the colors, red, brown, black, that, especially the red, that really triggered for her or tapped into those sensory memories.
Mhm.
And we were able to use that. And then she could opened up her mouth and told me what happened. So it took play and art. It was over about 4 or 6 weeks. I'm still an intern, and it went to court. By the time it went to court, I got my master's. I became an expert witness with ink still wet on my degree, right? Using art as forensic evidence. So yeah, that pretty much lit my fire, and he was found guilty. And this was a 3-year-old piece of artwork. So I from that, and they're still looking at that. I think we haven't talked at all really about neuroscience, but a lot of neuroscience research supports the use of the creative arts. And just sum that up is we store our memories and our experiences, even the good ones, on a sensory level, not in our cortex and words, but in images and all our smells, our touch. And art taps in. It's a sensory-based modality that taps into those sensory memories. And we have to go there neurosequentially, bottom up, before we can get to the words. So that's really the advantage of what we do. All right, that's my story.
That's a wow story.
Beautiful story.
Mhm. Thank you. Thank you. Powerful and beautiful.
Anyone top that one?
Well,
Not top. It's not competition.
Right.
But Rebecca, did you have a story?
There's several that come to mind immediately, even that happened this week in sessions. And it's something that I feel like whenever I find myself kind of getting stuck in a rut or a little crispy around the edges and kind of in need of some self-care, I find it's really easy to just on a personal level, just in connecting so intimately with someone, through the creative process, it opens up, layers and levels of communication that otherwise wouldn't exist. This week alone, there have been so many powerful aha moments. There are several that come to mind immediately, just kind of throughout my career. And one actually that's similar to Peggy's, that was a young woman who had experienced a pretty horrific sexual trauma, and had not been able to talk about it, was going to court soon after leaving treatment. So it was very much at the front of her mind. She was going to have to face her attackers. And we actually did some work with collage and ended up doing an altered book. So she had containment of being able to actually close the book. And we went into it very open-ended. She ended up using it to tell her story, and in her book actually illustrated her attack. And actually with that asked me to go to group with her so she could then tell her peers what happened. And it gave her a little bit of removal from it, because it was almost like she was telling, she was reading a story or sharing a book. And it was just really powerful. It was, and just being able to witness something like that, to witness the courage that it took for her to do that. And from then she moved on to doing more work around really building up strengths and, continuing to work on containment and finding internal power and some internal locus of control that I don't think would have been possible without the creative process.
I agree. So doing the art process actually helped her have a healthy form of dissociation where she could tell the story without being re-triggered and have the words, the neural piece, the neurological piece. Okay, it's
In trauma
beautiful.
processing, we often use something to distance, like some kind of metaphorical distancing.
Mhm.
And the way in which art expression can both contain and express and offer distance and offer a reflective place to figure something out and a feeling of control and feel soothing and resourcing.
Mhm.
It's just fits with any kind of complex trauma work. Like
Mhm.
it really extends the ability of clients to feel like they have some control and to be able to develop more inner knowledge, because it's so hard to reflect inside, and to
Mhm.
be able to create something outside that is about something inside gives it a safe space and distance.
Mhm.
That's what I got from you, Rebecca, that story. And the way you've been talking about how you work really, to me, is like the heart of what art is good for, that real show me your feelings in a way, get it out, and then stand back and reflect and connect. And it becomes another kind of an indirect way of mirroring your client. We think of mirroring and attuning, but sometimes our clients are so closed off and so siloed off, they're scared to connect, and art is that kind of in between place where it can be more safe, I think, to have connection because it's not so direct.
Mhm.
And it's not this eye to eye looking as we're doing now and talking, but rather we're looking together at a piece of artwork and we are
Mhm.
giving a holding space for that client. Metaphorically, what we do is therapy.
Right.
Giving up that safe sanctuary and holding space
Mhm.
for them to be creative.
It's absolutely true.
Mhm.
So I have a different kind of story, and this is why I ended up going back to school to becoming an art therapist. It's not the only reason, but this was 36 years ago. I was a brand new drug and alcohol counselor. It was the Wild West then, a little bit. And I remember my supervisor said, "Well, you're an artist. You should do art therapy." I was like, so he basically handed me a box of crayons, Xerox paper, and shoved me into a room with a family. I was like, what do I do now? So he did give me a directive, which was to have people paint. It's very shamanic, really. Their underworld, their middle world, and their upper world. I had no idea what was going to emerge. But the thing that struck me was how much was revealed in those drawings. So at the same time, I was reading a book by Bernie Siegel, who did a lot of art with people who had cancer. And my brother was hospitalized unexpectedly with a brain mass. He was 4 years younger than I was. He was in a way more like a child than a younger sibling. I was really attached to him. And he was stuttering and his balance was off because of this brain mass. And he was scared. So I went to see him in the hospital and he literally had to hold onto the furniture just to go to the bathroom. And so this is my brother who'd always been athletic, was super fit. And so I brought art supplies because we used to do art together as kids. And I used a Bernie Siegel technique. And I thought, well, what the heck? I mean, maybe it'll help him be less nervous. So I had him draw the brain mass. Now, even Bernie Siegel says this doesn't work all of the time, but this speaks so well to mind, body, spirit. I asked him to draw the brain mass as a monster and then shrink it every page. I turned the page, he drew it smaller and until it was just like a dot on the page. And he's kind of like, okay, cool. I was kind of like, Okay, cool. I come back the next morning. They are discharging my brother from the hospital. His brain mass is gone. He has no symptoms. He's not stuttering. His balance is fine. And they're like, oh, sometimes these just go away. Okay. So it could be that. I can't claim it was because of this exercise, but the possibility that this exercise contributed to that experience I was thunderstruck at the power. And I have not, like in the 30 odd years since then, I have not been disappointed about the power of art therapy. It has shown up to help people physically, emotionally, spiritually, every way possible. I've had clients spontaneously have Kundalini experiences. There's that spiritual aspect that we can't even really fully explain in our sessions. And a person went, whoop! Like I said, what happened? It's like the energies just hit the bottom of my spine and shot out the top of my head and totally changed the person.
Mhm.
So it's not that we don't understand art therapy, because we do. We have the neuroscience, but there are aspects of art therapy that defy at this point understanding. They go beyond our understanding, and that's so exciting to me. There's still mystery. There's still something to explore. There's still avenues to check out and learn. So that's one of my many inspirational stories, but I keep going back to it because
I
I
love your
watched.
spin on that. I love that spin, because art therapists, one of the things in our field is we don't all agree on the definition.
No.
And it actually can get a little contentious about what is it. And I
Right.
think you just defined it by the mystery of art.
Yes. There's a mystery.
I think we draw the definition rather than put it into words.
It's better, isn't it?
Mm.
So, Elizabeth, did you have a story you wanted to share about being
I think
inspired?
kind of like playing off of what you said, though, a few things come to mind for me around the power of experiences like that, that there's been art as long as there's been humans.
Mhm.
And this is a co-processing of between the material world and our physical and our mental state, back and forth, a conversation. And we like to box everything in our little Western mindset. Our clinical mindset has lots of frames, right? And these frames can be limiting, I
Yes.
think, in lots of ways. They're very useful in lots of ways. They help us kind of guide us in lots of different ways, but to also know that they're something we've created too.
Mhm.
And there's mystery beyond these frames that we carry, about what it is that expressive arts brings, what expression in general brings. And like I think of some work like of Joe Dispenza, and the idea of the imagination and the placebo effect and all of that. We think of that as not real or kind of artificial, but in fact that is spiritual. It's deep, and it's the power of imagination actually to manifest. And art has the potential to make that more real, I think, in a way, by that conversation we have with the material world and through creativity. I don't know, I don't know about a story. I just think you guys have told such beautiful stories, and I could add more stories, but they're really, you covered a lot of the territory I would cover in a story. It's a pleasure to be an art therapist. I think that's one thing that makes it rings for me on a daily basis, is just I hear a lot of trauma stories. That's what I do. And to be able to engage in creativity is so soothing around that necessary activity of helping someone with their trauma. To be able to engage in creativity is grounding, and it's just soothing, and it makes being a therapist a lot easier.
Yes, it does.
A lot
And
less
sustainable.
Yeah.
Go ahead. What did you say, Peggy?
a lot less stressful. I mean,
Yes.
if you look at in the past maybe 3 or 4 years, a lot of the pioneers of art therapy have passed away in their 90s and late 90s, all still working in some capacity, even if it's just consulting, writing, or doing their own artwork. I mean, Edith Kramer, one of the founding mothers, was, I think, 98 or 99.
Wow.
Myra Levick passed away a few weeks ago at, in her 90s.
Wow.
So, and I think art is what sustains us. We don't get as many stress-related, I think, issues from this work. Especially, and I think we can add that piece, are we all doing our own artwork? I know I do I think we find the time, sometimes it may be a 5-minute scribble as a response piece to a client that day, working with my own countertransference or the compassion fatigue that may set in, and to help process that, and just to do art for fun.
So important. Okay, so we still have a little time. So I'd like to spend a little bit of time talking about the neurology. And one simple thing that I think would help explain it, one aspect of the neurology to new therapists or drug and alcohol counselors is how trauma, trauma impairs the corpus callosum, but using it can help repair it. And so, for example, I use blind contour self-portraits where you draw without looking at the paper. And this forces you to use the corpus callosum. And excuse me, I refer casually, loosely to this process as an internal EMDR or an art therapy version of EMDR, where it helps you with the bilateral processing. And I find these blind contour self-portraits, which I've adapted from Elizabeth Layton's work, to be extremely powerful. So I know all of you, I think, Peggy, I know you lecture about the neurobiology of art therapy. So maybe you could contribute a few words to that.
Well, I do EMDR, so certainly the bilateral movement is inherent in art making, especially if you use both hands. There's just that back and forth on both sides of the brain. But art also uses the whole brain from bottom up. So it's not just right, left, but from brainstem to limbic to cortex. And there's a natural neurosequential flow to that. So I use Bruce Perry's work, who works with children, but I think he developed the neurosequential model, and I apply it to adults because it's still the same. We're still doing bottom-up work, and EMDR does the same. So the best way to look at it, again, just using art because that can express it, is if we do a scribble drawing, just drawing a scribble, both hands, one hand, and it's spaghetti, it's a tangle. But we have an art directive called the squiggle, where we look at this scribble drawing and we look for an image and develop it into an image. It's like looking at clouds and seeing an image. So now we're moving into the middle part. The brainstem is that just random movements like a toddler would do. The brain, it moves into the limbic system where we're organizing the chaos. And what a metaphor that is, right? For therapy.
Powerful.
Organizing the
Perfect.
chaos and giving it emotional meaning. So now we're attaching meaning to random movements, and then we verbally tell a story about it. So now we reach the cortex. We've given it emotional meaning, and we've organized the chaos into a narrative. And once we can organize that chaos, that we use that word soothing, talk about how soothing that is, how grounding and containing. So a simple art exercise of scribbling and turning it to a drawing uses that whole brain from the bottom up. So I use that example for that neurosequential.
Especially if we're using both hands.
And both hands back and forth. Like you can do a scribble with both hands, but then organizing it. And it is also a good introduction, I'll go on. I know Elizabeth can talk to this as well, but how we integrate other models into art therapy. And I think that's an important point. I mean, CBT, DBT, IFS, EMDR, EFT, you can give me any model.
Yeah.
And art can really enhance it.
Yeah. thoughts about that, integrating art. When we're dealing with very complex clients, often we know that parts of our clients feel developmentally really small and arrested.
Mhm.
And when they're in those neural parts of their brain, they're not integrated well with that higher cortex kind of reasoning. And art is concrete. It has a concrete way of teaching and connecting to those parts of our clients that we are trying to integrate and be able to reach higher level second order symbolic thinking, so that they can think and problem solve their way out of those situations where they get caught emotionally hijacked. And we know with a lot of our clients who have very complex trauma and addictions that they have very small tolerances for emotions. They get into very deep emotional traps. And to help them find ways to use art or some expressive modality to help them connect
And regulate.
So I think of neural integration, that is really what we're doing, is neural integration. Some of it is the bilateral, which I think just has this calming effect, but also it's dual attention, inside and outside, that helps connect and what's external to what's been really closed off internal. And so it's grounding, and it helps the client also engage their mental world and stay present in the present moment. So being mindful. We didn't talk much about mindfulness, but that's another big
piece of it, right?
Big piece, yeah.
Well, art's a meditative experience, so it's built into it. And there's also evidence that repetitive learning and repetitive movement helps develop new neural pathways. So if you have trauma-sensitive neural pathways, we can't get rid of them. They're going to be there. They won't wither away. But we can develop new, healthier neural pathways that override them, and the repetition of artwork.
Sensorial, right? It's Maria Montessori, right? Sensorial learning, right?
Yes. And the other piece that we haven't said, and I really do believe this, I think you give me any diagnosis, and attachment disruption is at the of it, right?
So the art can be a bridge.
Yes.
For attachment disruption. Yes, totally.
Well, the relationship, when we as art therapists, and I'm including all the arts because it's giving music, a musical instrument, or a costume and dance, right? But we can actually ethically give a gift to our clients. Here are art materials to you. And talk about that being a bridge and building attachment.
Also, the art pieces, but the art pieces can be a transitional object for those that have broken attachment and were abandoned or neglected in childhood, or their toys were destroyed or thrown away, or for them to take home art that connects them back to the therapy session, especially for those who have, and it seems the more wounded, the shorter period of time before they feel very disconnected from the therapist. So that's why some people need 2 or 3 times a week versus once every week or every other week. So it's almost like starting over with developing the rapport, but having an art piece to take home. I think it helps extend the connection.
Absolutely.
And hold it.
Absolutely.
So you're absolutely right.
And we know that disrupted attachment, that's Van der Kolk talks about developmental trauma disorder. While it's not a DSM, it should be.
Yes.
And how trauma disrupts across the board all development, emotional, social, physiological, and then the adverse childhood experience, the ACE pyramid. So we know people who've had attachment disruption trauma, the earlier and the more adverse experiences, the more likely that they will have a substance and addiction use disorder.
Absolutely. Right.
Right.
The ACE.
It's the adverse childhood experience. So,
Yep.
ACE. And that can include divorce,
Mhm.
job loss. It doesn't
Yeah.
have to be sexual and physical and emotional abuse. It's
No.
still war's a trauma, poverty is a trauma.
Mhm. All of it.
Right.
So that's the Kaiser study for those of you that don't recognize ACE. Okay, so we have just a few more minutes. And we're very close to the end. Is there anything that anyone would like to say in closing
I really
to
like
our audience? Oh,
little
sorry, go ahead.
I know we didn't have much time, but that piece on attachment is so important about the art object.
Mhm.
And there's such a connection through that physical object
Mhm.
that clients carry and they hold in their mind in a different way.
Mhm.
So, but that's not a final statement or anything.
No, it's
Erica,
good.
just a thought that came out of what your discussion was with Peggy.
So it's the adult version of a teddy bear. That's what how
Mm.
I explain it. It's the object that helps clients know that you'll be back and they'll be back and that you're not going away forever. I think it helps the object permanence problem that seems to be arrested in so many people. Where uh, for those of you that don't know, object permanence is when you show a rattle to a baby and they're all excited and then you hide it behind your back and they don't look for it because they don't think it exists anymore. That's my simple way of explaining it.
Until they
So-
learn it does.
That's right.
They learn it does. Yeah.
So it's a stage. It's a stage of cognitive development. So, but
But
if
it
you've been,
brings the
sorry.
full circle is that the client is making art as well and it's being valued. So their self-worth and that shame is so lifted that they, whatever they create, we accept non-judgmentally. It's not teaching art. It's not judging art.
Right.
They can make a mark on the paper and we are going to celebrate it. Right. So if
Absolutely.
you're not an art therapist, just that gift of giving paper and crayons to a client, letting them do the art, not judging it, but whatever they do and having them talk about it, that's the basic foundation, but that can be enough.
That can be enough.
Enough.
Back to expression and integration, a lot of threads that we've talked about. I had a client here for an intensive from another part of the world, and the the person showed up and said, "I hate art therapy." I was like, "So how did you sign up for 2 days for art therapy?" So in the body map on there was a point in time when that person started to be angry with me. Normally I would not have a person paint their anger on a body map, but I was like, go for it. Just paint your anger here, because if you don't know me well enough to be this angry at me yet. And then I had the person stand back and look at it. No analysis, no interpretation, just quiet reflection of her painting. And she turned to me and she said, "For the first time in my life, I'm all here.
Wow.
For the first time in my life, I have insights and they're mine, and I'm not giving them away."
That's chills.
Right? So that still gives me chills. So, and I didn't say anything. It was her dialogue with her own art. That's something. So I will just wrap up a little bit. I'm so glad that the audience got to hear theory, practice, scope of practice, meaning, definitions, a little bit of the neurological piece of art therapy, the spiritual, the energetic, the transitional object piece. There's so many pieces, I won't catch them all. Oh, the ability to heal physical. And so I invite you to learn more and to join us and to join this amazing faculty. I'm crazy about them. I'm not unbiased. They're all scholar, academic, well-read, well-trained teachers, and they're really experts in the field. So I hope this is the teaser to invite you to our world of image, whether it's art or, as you can see behind me, sand play figurines, and consider bringing creativity into your personal life, as well as the treatment that you offer to drug addicts and alcoholics, because I do believe it extends their commitment to treatment. There is research that supports that. When art therapy is part of treatment for drug addicts and alcoholics, they're more likely, and I should say substance use disorders, forgive me, I'm an old timer. They are more likely to stay in treatment until they've completed their treatment goals. It helps engage and inspire. So, and I use my own art to help me with all the COVID stress of that. We didn't even talk about that. So join us, and please feel free to call us or ask us questions and email us. We're receptive to talking to anyone who might be interested in coming into our field and going to college, graduate school. We will encourage you. We'll support you. So thank you.
Thank you, Erica.
Thank you so much.